I'm Dr. Mehmood Butt, one of the consultant interventional cardiologists at King's College Hospital, and I'm going to talk about the shockwave therapy. We are very proudly announcing that we are one of the largest shockwave centers in the private healthcare in the UAE. Shockwaves is a simple balloon which delivers high intensity and high frequency sound waves to your blood vessels. As you would imagine that when the arteries block in your heart, slowly it accumulates a calcium. Now that calcium makes your arteries like a hard shell. It's very difficult to open it, and it's very difficult to keep it open after you put a stent in. We want to not put a stent in your heart in the first place, but we need to break that calcium. We need to dissolve and disintegrate that calcium, without which we cannot open your arteries. Most of these patients, they will end up with a bypass or very complicated procedure such as drilling of the arteries. For the last 6 years, they have developed this new technique in which we deliver the shockwave therapy to the blood vessel where there's a lot of calcium accumulated. What it does, in a shell, if you imagine the artery is like this and there's a shell of the calcium around it, you place a balloon in it and then you deliver the sound waves, and those sound waves, they create cracks in the deeper tissue of the calcium. So what it does, it buries the calcium deeper into the tissues of the arteries, and then that artery opens up, it becomes more relaxed, and then you can treat it just with a balloon most of the time, and sometimes with a stent as well. Believe it or not, it doesn't have any side effects if you do it properly, because the sound waves are not radioactive anyway, and it takes a very short time, it's usually 10-15 minutes. If you have done enough of them, then in most of the patients it's very successful. It can be employed in patients who have had stents before or who have never had stents. In addition, it can be done as many times as possible. It doesn't accumulate in your body. So it's a very safe procedure, and I'm very sold onto that procedure because it has helped a great many number of my patients.